85% of chronic back pain patients notice an immediate change on their first visit, even after months of failed care elsewhere. Give me 3 minutes and I'll explain how we do this, why our results are long-lasting, and the different types of service we offer, which are different from the drug, surgery, physical therapy, or chiropractic adjustments. Hi, I'm Dr. Roy Picard, DC with Michigan Integrative Health. People come into this office to see me and the medical team all the time frustrated, not because they haven't tried care, but because they tried everything and their back pain just keeps coming back. And what we have found is that this occurs because most doctors, therapists, and chiropractors tend to focus on symptoms, not the root cause. After seeing thousands of people, we know that chronic back pain almost always comes from one or more of 3 fundamental components. Let me break them down simply. Component number 1 is inflammation. Inflammation irritates nerves, restricts movement, and keeps tissues from healing. And here's the problem. Most people are never properly evaluated for systemic inflammation. They're given medications to suppress pain, but nothing is done to determine why the inflammation keeps returning, whether it's metabolic, dietary, stress-related, or related to previous injuries. If inflammation isn't addressed at its source, pain will last forever. Component number 2 is joint instability. This one surprises most people. If the muscles, tendons, and ligaments of your back are doing their job, the joints in your back will work as pretty much designed, giving you full range of motion, proper strength, and no pain. But when the muscles, tendons, and ligaments of the back are not performing their job, it creates pain, stiffness, weakness, and recurring flare-ups. At our office, we perform specific movement-based testing to see if stabilizing certain joints immediately improves strength, motion, or pain. If you notice improvement during testing, it tells us right away that instability is a primary driver of your pain and that we are going to be able to help you. Component number 3 is tissue damage. Sometimes the issue isn't inflammation or instability alone, it's actual damage to muscles, tendons, and ligaments, or discs. Scar tissue, degeneration, or prior injuries can prevent normal healing. If damaged tissue isn't identified, people bounce endlessly between therapies, injections, or wait-and-see approaches that never truly resolve the problem. So even when damaged tissue is identified, can you name a drug or a therapy that can repair the damaged tissue? Some providers do not focus on any of these. Some focus on maybe one of these areas, but if you have 2 or all 3 contributing to your pain, partial care equals partial results. That's why people feel temporary relief and then the pain returns. At Michigan Integrative Health, we do things different than most, if not all of the doctors that you've already seen. Our 3-step process gives you answers up front. Step number 1, a complimentary phone consultation to understand your history. Step number 2, in-office testing to see if you experience real, measurable change during your visit, because without you experiencing that change, we cannot accept you as a new patient. Step number 3 is written care options based on which of the 3 components are actually causing your pain, so that you can choose what makes sense for you. No guessing, no endless waiting to see if it works. You know immediately on day 1 of our in-office testing.